Okay, welcome to this session as we look at exploring the enhanced NHS Knowledge and Library Hub following the transition to the new EBSCO Discovery interface earlier this summer. So the NHS Knowledge and Library Hub is available to help you find high quality evidence resources without needing to learn complex search techniques. So the hub has had a significant upgrade with a less cluttered feel so you can focus on finding the evidence you need quickly and simply. And just for the benefit of those who've not met me before or attended one of my webinars, I'm Richard Crooks. I work for the EBSCO Customer Training Services team based here in the UK, in the Midlands. I'm a senior customer training specialist now with EBSCO for almost 14 years, and I train across the UK and Ireland typically, and also have worked previously in the NHS as a librarian or in various library-related roles. So glad you could join this session this afternoon. I appreciate for some you may have attended before. You may want to see some updates, etc. But in terms of what we're going to cover, we'll look at navigating the interface, the use of natural language searching as a search mode, combining searches within the interface itself, saving and exporting results, and also using the MyEBSCO personal account. So we won't go into too much of the searching aspect as such. It's very intuitive, but we'll cover some aspects of this and particularly the features that are available to you, just to make them clearer to you, especially when you're looking to train users, advise your patrons and so on. So in terms of the actual training objectives, I hope that by the end of this session, so within the next hour, you'll be able to navigate and identify the key features of the updated interface and also find, where to go to find more information. You'll be able to conduct evidence searches using natural language to find relevant records. So we'll see that demonstrated. You'll be able to combine search terms and searches for more precise results. And also you'll be able to save and export results in RIS or RS formats, as well as other formats as well for use with reference management tools. You'll also be able to create, store, and retrieve saved records used in MyEBSCO personal account as well. So I hope that's what you're expecting. If there's anything else, please do put it in the Teams chat and I'll try and respond to you as soon as I can. So just a recap then, a reminder of the functionality or the function of the hub itself, which we refer to as the EBSCO Discovery Service here as well. So it is designed predominantly to support rapid access to evidence from journals, books, and other sources. So it's searching across multiple sources from multiple providers, and these can be national subscriptions, they can be regional subscriptions or local subscriptions as well. So there's this caveat that's not designed or intended for carrying out systematic, reproducible searches of the research literature that are best delivered in more advanced interfaces that you'd find with EBSCOs, for example, if you're searching cinema and Medline. So again, for more in-depth advanced searching, you're going to go straight to those databases and search them individually. Okay, but you can find, information quickly through this service. So the basic search screen, of course, is the default interface, as you might expect. And you'll notice the grey banner, and we've had comments about the grey color. So we are putting a case forward for changing the color back to yellow, as it was originally in the first version of the hub. But in any case, there's a link there to prompt users to sign into Open Athens. So generally, we'd advise users before they start searching to sign into the Open Athens account to ensure they access the value-added content, full text articles, publications, and so on. There's also a link here for Open Athens registration, which means if there's any issues with Open Athens, they can refer to the information there, etc. Or if they need to request an account, they can do so. Okay, so guest access may be enabled where you are, but we do advise users, logging in straight away, almost immediately to Open Athens. Now, we have had questions about the content coverage of the hub, what's indexed, what's searchable, what's discoverable. And generally, I would advise going to the solutions page of the service desk because it does give you more information about what resources are searched. So I'll include a link in the PowerPoint and you will have a copy of the PowerPoint along with the edited recording post-session at some point. So again, it's a good place to go to for more information. And in terms of ebooks are also included as well. We'll see that in the site that we're going to use today for the demonstration. So EBSCO is, of course, dedicated to enhanced accessibility. That's in line with the European Accessibility Act, which was applicable from June this year, and also the equivalent acts in the US, as you might expect as well. So these regulations emphasize equal access to digital information as a fundamental human right. So EBSCO supports this by integrating accessibility into product development, which means that in terms of ebooks, we support the use of EPUB 3 content now, the text-to-speech functionality, customizable font size and spacing, accessibility metadata for discoverability, and so on. So there's ongoing effort at EBSCO to ensure that the products that we provide, the interface we provide, meets accessibility guidelines. So as I said, the European Accessibility Act, the EAA, took effect in June, late June this year, and we also support other guidelines as well. So again, just a bit of information there about the efforts to ensure that information is accessible to all. In terms of the actual elements covered that we'll look at today, basic advanced searching, less advanced searching, because obviously that's covered in the EBSCO's databases, and you've not yet migrated to the new interface for EBSCO hosts for CINAHL Medline. You are using the new interface for the hub for discovery. Filters and limiters, where you can find search results. The My Dashboard, the area where you can access your folders, you can save items and retrieve them from there, and also research tools, including the help page as well. And MyEBSCO, which is the personal account, which gives you access to additional features as well. So in terms of the interface, we're back on it again in this screenshot, this time signed into Open Athens, so the grey banner's gone. You have the single search box, which gives you quick filters, such as full text, peer-reviewed content. You've got access to the natural language search, which we'll explore in a moment, links to advanced search, and also the Pico app as well. There's also the quick evidence summaries, so you can access quickly the BMJ best practice, the Royal Marsden Manual, the NICE clinical knowledge summaries, and the British National Formaries, so for drug information. So again, quick access when needed. And also, as I mentioned, the dashboard feature, the panel on the left, which gives you access to projects. These are your custom folders when you set them up. The save folder, where items are saved by default. Recent activity, which records the search history and any viewed content. Alerts as well, so if you want to set up search alerts or journal alerts, you can do so there, or access them from that section. And also research tools, if you want to rerun the search or clear the screen, you have new search. Publications A to Z, that's on the left there under research tools. That is the Publication Finder Journal Search Service from EBSCO. You've got further resources. There are additional sources that you can look up as well as a user, and the Publications Authority. So Publications Authority is simply a way to identify journals that are indexed in EBSCO's databases specifically. And then for the essential links there that you see after research tools, there's the link to Open Athens registration, Browse Journals, which is the browsing journal service. So you can check out journals through browsing provided by Third Iron. And there is an online help menu as well. When you are searching and results are retrieved, you can also apply other filters as well. So you've got the standard ones like full text, peer-reviewed content, all time or past 5 years or past 10 years as the publication date option, and also the source type, which relates to e-journals, academic journals, ebooks, books, and so on. And also all filters would give you other additional options, including language, content provider, so the source of the records. So it could be CINAHL, it could be Medline, it could be another database from another provider, etc. So we'll look at those live. Just to add here as well before we do so, we do support the exporting of records. And as you can appreciate, with the hub, you are going to generate a lot of hits, a lot of responses, a lot of references, because you're searching multiple sources through one interface. So we do have the option to export up to 25,000 records in one session. Okay, so if you have 25,000 results, you can export all 25,000. And for that, you would then need to be signed in to your personal account. Now, as you are in England in the NHS, typically your MyEBSCO folder account is synchronized with Open Athens as part of the EBSCO single sign-in authentication. So you shouldn't have to go through this step essentially, but it will give you this form, and you will notice on here that you can use this feature multiple times, and you can export up to 100,000 records within 24-hour period. So again, you can export that quantity of data in a 24-hour period. So in one sitting, 25,000. Across a 24-hour period, you can export 100,000 records, okay? And what will happen once you've obviously designated the recipient, it could be yourself, it could be a clinician, and chosen the preferred format, which could be RS format. When you send that, you'll get confirmation on screen that a link to download the exported metadata records has been sent to your inbox. and you can click on that and extract those records and import them into your preferred software. So it could be EndNote, for example, RefWorks, and so on. So reminder, we do have that functionality available. So just briefly then, just before we go on, from Janet, I have a question. What do you do if the format chosen turns out not to be supported by RefWorks? I guess there's the anticipation that the user would know that is. So basically, there is an option to, I think if I go back a step here, you can see that there. So RIS format is there. I know in other menus, it does display RefWorks as an option. So I think at the moment, we just display XML, CSV, BibTeX, which is used in academic circles primarily, RIS. Okay, you've tried RIS and RefWorks refused it. Okay, well, that's something which would be flagged. I will mention this again at the end, but if you have any issues like this, where you encounter technical issues or as Janet mentioned, that RefWorks refusing a RIS file, then yeah, exactly, raise with the help desk. So raise any query like this with the service desk, your NHS service desk initially, and when necessary, they will escalate to EBSCO. So there are reporting procedures with EBSCO, but because this is NHS England, we're doing these sessions for, then you should use the NHS service desk. Okay, BibTeX did not work either. Yeah, so those kind of questions need to go to the service desk, and then when necessary, they will escalate those to EBSCO and they will follow up accordingly. Okay, so sorry I had those issues there. So again, using MyEBSCO, you'll see a link on the interface to MyEBSCO that will open up the option to sign in with your account. But as I said, by default, you should be already signed in to an account as part of the single sign-on authentication. Okay, there are options obviously to create your own account as well, but I won't go through that today. We do have this tutorial on MyEBSCO and also the dashboard for this new interface. So I want to explore that further. So I won't play that, but we will go to the live demonstration. So I'm going to use a particular trust account because they have got ebooks available, etc. in that account. So let me just do that now. Okay, so let me just share my screen here. Okay, you should now see the NHS Knowledge Library Hub for this particular trust. So the interface will look very similar to what you have in any case. The big difference here will be some of the content you may not have available. They may have upgraded to a certain database, for example, from Cinel, I think to Cinel Ultimate and things like that. So you may have different versions of different databases, but the principles that we're looking at will be the same. The first thing to note here, of course, is the single search box. And the thing I want to point out here specifically is the natural language search. So on here, we've got this option to enter a query. So with natural language search, you either enter in the form of a question or a statement, etc. Okay, so I am going to enter this one here. So this will be, what are the admission, sorry, let me just add this correctly. What are the admission requirements for in acute care for dementia patients? Okay, so I'm going to add that here. Okay, so we've got now, unfortunately, because there's a current service issue that's been investigated, we're not seeing the refined query. So typically above the result list, you'll see a link here. It says show refined query. It's not showing at the moment. There is a known issue about that. So again, that's a recent issue. So typically you will see the refined query, and it will give you the Boolean query. It will give you how AI, that is a large language model, which is called Haiku, has rendered that search based on my question. And you can then see explicitly how it's searching. We can, however, see the results below, and you can see the terms highlighted in yellow there, etc. Okay, so there's currently an issue with that. So unfortunately, I can't show all the details that we would typically have available. And of course, with this kind of search, you would probably narrow it down in any case as well. So we have got, for example, full text peer-reviewed content. If I go for last 5 years and then choose the appropriate format. So at this stage, I'm going to go for academic journals only and apply this. And then say, for example, I want English only, then I can click all filters here and choose, scroll down here, limit by English there. Okay, and apply that. So again, you've got quick ways to filter results. And then we're seeing what we're seeing at the moment are the most relevant results, but you can sort for the most recent as well here. So you can just get the most recent records displayed. Okay. So again, from this particular journal, etc., you see results appearing here. Okay, but these are recent, not necessarily the most relevant. So again, you can switch back to the most relevant, and that's based on the indexing of content, as well as with the words appearing in the title and abstract and so on. And we can also change the display to see up to 50 records. So on this particular trust, they've got only 20 records showing per page. You can increase that to 50. And that means you can save from the menu above up to 50 per page here. Okay. Whenever you save records here, if I click 1 to 50 here, they'll be displayed in the save folder. In fact, not here at the moment. Sorry. Recent activity. I don't think they'll be here either. Sorry. You need to be signed in for this. Okay. So let's go to back here a moment. Actually, go to recent activity. So this will just record what I've just done, basically. And you can see here the searches. So you can see where I started from, the initial search, and I've applied other filters here as well till I've got to this number. So it's tracking my search experience, etc. And then I can go in and view this again on this screen, etc. Okay. So I've got these results displayed below. Okay. And we can look at other ways of searching as well. So this just gives you a brief review of natural language searching. Again, unfortunately, I couldn't show you the refined query it normally displays. Okay, it is also on the advanced search page. Probably less likely to use this because of the nature of discovery of the hub, but it is also listed as a search option here as well. Okay, so you can perform a natural language search on this box as well in this area also. Okay, yeah. So another question's just come through here. Okay, good question, Janet. Yes, why can't you change preferences any longer to see more or less of the record? That's a good point. At this stage on this interface, as we'll see, so I just run this again here as it is. You've got the default settings. Now, one of the agendas, if you like, at EBSCO is to ensure that the interface is compliant with accessibility guidelines or WCAG guidelines, etc., to reduce the cognitive load on users in terms of the white space, also to support screen reader navigation and so on. So there is a more of a briefer format for records displayed, as you see here. If you want to expand the fields, you can do that. So if you want to see the authors, then click on the plus for more. So there are additional authors here for this article. Likewise, you can show more of the abstract and also the subject fields. So you've got 30 more subject fields here, or subject terms listed. So if you have all of these fields open by default, it does tend to clutter the screen quite a lot. It does mean that you're scrolling through more information on screen here, although you can actually expand each record. Now, I know Alan Frick has received feedback about this, and there's some who would prefer to see the abstract displayed in turn for each record that you see here. So you could collapse the author field and the subject field, but have the abstract displayed. But at the moment, you don't really have control over that. Yes, it is the same if you logged in. So basically, the only way to manage the results area, the way they're displayed in terms of the look and feel of the results, in terms of the abstract being displayed, either you do that by yourself as you're going through the list, or in the admin tool, it's configured to show the abstract by default. So obviously, for showing the number of results, you can change the settings here. Even though the default setting, you can override that. Likewise, you can share by relevance, or most recent, or the oldest. You can do that. But in terms of the abstract, it has to be centrally managed. So again, it would have to be agreed at a national level within NHS in England to configure it that way. It can be done. It's just a question, is this suitable for most accounts, as it were? Yes, and it's the same functionality for Sentinel Medline. So although you've not migrated to those databases yet on the new interface, it is currently the same. So no doubt it has been recorded, identified as a potential enhancement, that there is that feeling there of a need to be able to configure that yourself. But again, at the moment, it's centrally managed, and therefore the display format is determined centrally. So that is configured in our EBSCO Experience Manager tool, which again for this account will be centrally managed. But thanks for pointing that out. Again, we can again remind others that this feature is there's some debate about the functionality there. Okay. So just coming off this page, then we'll run another search here, and again you can go to advanced search. You can come up here, and you can enter multiple rows here. You can add up to 12 rows, multiple terms in each row, or individual rows, etc. So, for example, if we want to do a search here on chronic migraine and acupuncture, then I can do that here. Okay, I can choose the list of terms which are generated. These are these are user searches across the globe, so these are global. I can use those, or otherwise I can combine with other terms. So I can use the Boolean logic here, and I can just select from these terms here and combine them together in one set. Now, also on this page, as I'm doing this, I can also choose, for example, full text only. I can go for EPUB, ebooks, etc., and I can specify the date, etc. I can even choose language here as well. So I don't know how many texts we'll find in terms of English here, but I could try this now. It might be quite specific. Yep, so I got 562. So what I've done here, you can see the search string above, okay, and I limited to full text. And if I want to apply other filters, go to all filters here, and you can see what the active filters currently are. So I've got EPUB ebooks published in the last 10 years. They're in English only. I've got these other expanders applied to. I'm limited to full text content. Of course, the ebooks there again shown there, etc. So these are now displayed on screen, okay, and ready to be viewed. So I can view this content. I can, jump into a record. So, for example, I can go into the detailed record page here. You can see it's published in 2021. You can see the author. I've got links there, so I can view the PDF or the EPUB, which is what was after originally. I can download as well. So you can see there are publisher permissions. So at the moment for this particular text, I can only download 15. So again, 15 pages. So this is only 4 pages, but if I go to, for example, this section here, it's 3 pages. So I can do that, or I could go to chapter 1. So I can download chapter 1 here quite easily, or I can go for a custom page range as well. I can also specify that here. I have the full ebook here as well, but I need to sign in to do that. So I can sign in here. So in my account, I'm not signed in, so I can sign in here, and I'll do that now. It's not going to allow me because I'm using a different account, by the way. So I'm using an account here from another trust, but I can download the metadata, as you can see there. So I can generate a record of this ebook in Word format or PDF, etc. So I can click on that and download it. And then in a moment, I'll drag that across if you can see it. So you can see here, this is the book here with the link there provided as well. So this is metadata for this ebook in Word format. Okay, so I can download that from there. I've got other tools as well. You can see I've got the save icon there, so I can save that item. That's now added to my saved items. But as it says, sign into your MyEBSCO account to keep your saved items forever. Okay, so I need to sign in there to do that. I've got the cite tool, so I want to know how to cite this. And by default, for the hub for NHS England, it's Harvard referencing. You can change it if you need to, but it's a default format or default reference style. So you can copy that to the clipboard. You can export the citation. There's RefWorks there, so you can export directly to RefWorks using this option. Or if you're going to export to other software, you've got RIS formats. You have got the choice between RefWorks and RIS format here, or EndNote there as well. And then there's the add to project option as well. So you can add this to project. You need to be signed in again, and I don't think I'm going to sign in here. Again, it's asking me to sign in here. So this is one disadvantage of using a individual trust. I'm not signing in at this stage. Share again is optional. That's where you can share it via Google Drive, OneDrive, or you can create a link to it. and then you can send via email as well. Again, the download option is there as well. Other options you've got the permissions there, number of pages that you can download, print, or email or save. Okay, this is the EPUB is EPUB 3, which is related to accessibility guidelines. And you'll see now we have this feature here. We have this automated accessibility check from Ace by Daisy. I don't know a lot about them, but you can find out more. Basically, it confirms the pass rate, if you like. So it's 98% pass for EPUBs. So almost 100% in terms of the accessibility of this particular title, as it were. So it's not available as a DRM-free publication, as it were. And then you can also go in and download portions of the text by chapter, etc. as well. Okay, so you can see that here and go into these sections, or you can view them online if you prefer. Okay. And on this page, since we're on an ebook, again, the site tools there, the share option, the download options there. You can view the table of contents and jump to sections as well. Okay. You can search within it. So for example, if you put in migraine, you'll see the terms are highlighted and you can jump to the specific section. These have to be references, by the way. Okay. And also we have text-to-speech software as well, so you can listen to it being read as well. Not that you read the table of contents. So you can, jump back to go to the top here. So if we go back to, just going to click, remove that, by the way. So if we go to the contents page, so you can go back to the cover, for example. Okay, and then you can, go to the contents pages here, or you can go to certain sections and then go to the specific section, for example, chapter 3 here, and then you can listen to that being read to you. Okay, so those options are available. So you can search within the text. You can also listen to text-to-speech software for the title to be read to you, as it were. So that's just an example of an ebook that you can access here. If you go out to results here, you can see also the access options are available below each title here. So if I want to go to the PDF version, you can go to that for this title. And again, you can see this. Jump to the sections. You can download again from here as well. And the text-to-speech software is also available for this. So if we just review this, if we go from ebooks to articles, then we can just remove the EPUBs filter there and apply this. Then we can review now other articles. So you see now we've got articles here. Again, similar approach. You can click through to the article itself for the metadata. So the detailed record page, again, you can download this. You've got access options. Now, because it's NHS England, we've got the PDF option. So that's from Third Eye, and you can click through to that. And it's using LibKey to get to the PDF content. Okay, so you have it. You can access it there online. You've also got here the complete issue from Third Eye. You've got the PDF as well, coming from EBSCO. Again, similar format. So you've got more than one option to access the record full text, online full text. If you prefer the HTML version from EBSCO, you've got that there. And the tools are above there, so you can save this. You've got the citation tool there again with the export option, add to project, share, and so on. You can also print it here as well. You can say it's a PDF, or you can send it to your printer. And we also have the table of contents here as well, so you can jump to the sections. And also for this, because you have the translation tool here. So for HTML articles, online full text, you can translate from this to another language. And likewise, if you change it to from another language to English, you can do the same. So this is the machine translation of this article. So I'm just waiting for that to just to illustrate that. Okay, so you can see it's now in, I think, Catalan. You can go back and you can jump back to the original language here. Okay, so let me go back here. So that's the online full text here. Again, you've got the metadata there presented. You can link to the authors, link to the journal, see other articles there, publisher as well, mesh terms. This is obviously from a Medline database, and the references there are also included as well. So have that information available. Okay, you also find things up more like this. This is the recommendations. So basically, based on what data we have, we can the system can prompt other articles which may be of interest. So you can view those. Okay, and you can save these as well if you need to also. And also the publication contents is listed here as well. Okay, so if we go back to the result list, you will also see this feature more like this on the result list as well. And it will come up with this extra panel. This requires an interlibrary loan, as you can see here. But again, and you can also, vote if you like, whether you found this recommendation useful or otherwise. You can scroll through to the next recommendation, and below that you'll see there's this disclaimer here about this recommendation. So you're exploring related research with unique metadata provided by EBSCO based on the terms you've engaged with. Okay, so again, that feature is enabled there. Okay, now if you were looking to save these records, again, you've seen the kind of saved icon, the bookmark tool there available, or you can save the list of records here. Okay, and save them, and those are saved under my dashboard within the save folder by default. Okay, so but notice you've got this reminder to save your progress, to either create the account if you need that, or sign in directly here. Now, as I've said and you've seen, I'm using a trust account, so I'm not authenticated through Open Athens to synchron that, as it were. So I won't be able to illustrate that today, but you would sign in here and you would save these records beyond the session. Okay. It also means you would be able to add these to a project. A project is simply a personal custom folder that you can sign it, can create yourself, and then you can collate your searches records in your own custom folder. So that's on the right side of the screen. Projects is there. Again, telling me to sign in, which I can't do for this account. Saved is the default folder for saving items and searches, but otherwise, and you would still need to be signed in to save them beyond the session, but you can go a step further and collate searches and the records you've retrieved in a custom folder you create yourself. Okay, so anything we've done here is tracked in recent activity. So you can see this latest search is recorded here. You can display it in the oldest to get the sequence where we started from, and you can actually delete lines here. So if you want to focus on a particular search, then you can go in and delete these lines, as it were, here, line by line. We do have bulk search delete coming. I'm not sure when that's due for release. It was due for release in October. So that's been somewhat delayed as far as I know. I don't think there's an option now to delete. No, I didn't see it, so no. You can download. So from the recent activity search history, you can download up to 500 records, or 500 lines. So if you've got a 30-line search strategy, as it were, here, then you could download those. So you would just simply go in and download, choose the format. So if you want a table, you've got the CSV format. Rich text is quite good because it collates each search string and places it together on the same page, as it were. So rather than Word, which would enter each search set on a separate page typically. So RTF may be the best option here. So click download, save, and you can open that up. And I'll just drag this across so you can see this. S1, S2, and so on. S4, S3, and S4. S5. Okay, so that's displayed there. Okay, and so that's the RTF format you can have. So you can download the search, as it were, and review that offline, etc., as you need to, or edit that as you prefer as well. Another thing you can do in recent activity is that you can edit the line of the search. If we go to this one, okay. So for example, you can go in, click search details, and you can edit the search here. So for example, I could put, for example, headaches in quotation marks here. So make sure it's an exact phrase search. Wrong symbol there. And I can also add headache as another word. So I can just add these words here, okay, and I can make changes to it. So I can update the search, and we go back to recent activity, you'll see that, click continue, and you'll see now it's added here, headache as well. So headaches in quotation mark, as well as headache, so you can check that out yourself. And there's another question just come through. So thanks again, Janet. Why doesn't it display the lines of search in a table as the old EBSCO used to? So good question, good comment. So that is coming for the hub, for the discovery. It was launched last week for EBSCO's databases. So what we will see on the advanced search page eventually for the hub, so we click new search here and go to advanced search. These 3 rows will stay on the search page. You'll see an option to expand the search history. So you'll see the 3 rows, you'll see the search history line by line, which you can then edit line by line. So that functionality is currently only available for EBSCO host. It is being released for discovery at some point. Okay, so for those who have signed up or are going to join my sessions next week for CINAHL Medline, we will review that live. Okay, so that's now live, that feature. So yeah. Okay. Okay, so would it be possible to export the search lines as a table? So essentially at the moment, the way you would export a search as a table would really be, if we go to, let's see, where do I want to go to? We go to recent activity. Let's just use this search for now. Okay, so we go here. I'll go to down there. We go to saved actually. Let's go to saved. Go to searches. Oh, we didn't save our search actually, so let me do that now. So I go back to my recent search, and I'll save the search. Okay, so I can just give it a name. So chronic. Okay, so I've saved that. I close here. So I go to my save folder here and go to searches. Got my search here, so I can save this one. I can add it to the project. Okay, so I think it's the download search option that I'm looking at here. So this one is, so basically this one is, so if you have if this was one search, but line by line, I'm just going to switch back to oldest. Okay, so if there's each of these sets was a different search set and you've combined them, then you go to the download option, or you save your download from here, and then you can save it as a CSV file. And I'll bring that on screen as well so you can see that, what that looks like. So obviously these are essentially different searches, as it were. But if I drag this across, you can see that now. So it does give you, okay, so this is 2 searches mixed up, so probably not the best illustration, but you've got line by line the search, and then the various queries, and then you've got the set results here. Okay, so basically you can see the search mode. I've used natural language. The various expanders apply to this, plus the interface, the database, results retrieved from, and so on. So you can, but this is, I would say, this is something you wouldn't necessarily use so much here as you would with probably within the EBSCO's databases like CINAHL Medline, etc. But it does give you each of the lines that the search is covered, plus the filters applied, the publication date, etc. We got the source type there as well, as you can see, and which the filters are applied here. So obviously I've mixed up 2 searches essentially, but that's the kind of layout you get for the CSV spreadsheet, as it were. So in a sense, you're exporting the search in this format. So again, you could go in more in depth than that. Okay, so basically once you create your search here, you have the line by line searching, but as I've just mentioned, for the EBSCO's databases, there is now the option to view the search history on the advanced search results page, and that will also come for the discovery. At the moment, it's not, it's there, it's going in that direction, but obviously with discovery, with the hub, you're doing more simple keyword searching than more in-depth searching, as it were. Okay, I'm conscious of the time here. So what I also wanted to highlight is, you have got another option of searching as well, and that is the PICO search app here. So PICO is basically the standard clinical framework that I'm sure you're familiar with. So the population, patient, problem, the intervention, the comparison, outcome, and so on, with the additional element of time or type. So it could be a type of study, it could be a time span, etc. So the two areas that you must use are the P element and the I. So for example, if you were looking at newborns, and for example, I'll put newborns or newborns, okay, newborn, okay, newborn. If I'm looking at a comparison between water birth and natural childbirth, I can add that here. So, and then the outcome is mortality, for example, infant mortality. Then I can run a search like this with these simple search terms and click add to search, and it renders, the query in this fashion. So it combines those four elements, and then I can search here within the hub. Okay, so you can see got over 200 records there, and you see records below. So basically, it's just using the PICO option as a framework to create your search, and then you can run the search and bring back a list of results. So again, provide rapid access to the evidence, the information that's available currently. And again, it's searching multiple resources, not just Medline, not just CINEL, it's across multiple resources. So again, the PICO app is available within the hub itself if you need to use that feature. So if you wanted to be alerted to new results or additional content, then there's the option to create the alert here. But again, you need to be signed into MyEBSCO. But again, it's a feature that probably will be used more likely within CINEL Medline on EBSCOhost. We've got obviously new search I've been referring to. It takes you back to this screen where you can access the quick evidence sources. You can use natural language search here. Publications A to Z, that is simply the publication finder service. So if you're looking for a particular publication, then you can add this one, for example, British Journal of, and it gives you the autocomplete. The autocomplete, by the way, on here on Publication Finder relates to the holdings of that particular trust library service. So you can see here, they've got the British Journal Midwifery, so I can go straight to that and you can access it, in this case, through Ultimate or the Mark Allen Healthcare there. Okay, so you can go to it there. I won't spend too much time on this. There are other options as well. So you can browse by subject as well. So for example, if you go into medicine, health sciences, you can go to, for example, cancer and view the cancer journals that are available through this particular trust. And you see the links there, including the Directory of Open Access journals here. So again, if users looking for publications, they can go through Publication Finder, and I'm going to just move on here. So, and then you can go back and also check further resources. So further resources are additional websites, source information that can be useful. One caveat here, presently, although you've got EBSCO's databases and this library subscribes to CINEL Ultimate, you're currently accessing the classic interface for EBSCOhost here, not the new user interface. So if you click through to this, it will take you to the original interface for searching. You've got Google Scholar and other elements here that you can refer to as well. Okay, so additional tools, NICE guidelines are also included there. Publications Authority, just to clarify, this will list databases that you subscribe to that are from EBSCO. So this particular service has Biomedical Reference Collection, CINEL. Actually, CINEL is what they will focus on because that's the latest version of the database. They've got Health Business, Full Text Elite, etc., Medline Ultimate as well. So some of these are national subscriptions like Psychology and Behavioral Sciences Collection, but the others are specific to this trust. So essentially what it means is you can search for journals, publications, for example, with CINEL Ultimate, you can go in and search for a British Journal of. So these are only publications available in those databases, and you can see that one here. Okay, you have got browsing too, to browse journals under essential links. So this will search the Third Iron journal service, as it were, and you can jump in, for example, to Nurse It, Iron Health content, and then you can go to a journal, for example, like Advances in Nursing Science, and browse the content there. But that's from Third Iron. And of course, you've got the online help here. That takes you to the Hub on the Hub page, and Alan Fricko has prepared a number of videos here. So if you want to know how to search the Hub more effectively, there are a series of very short videos, often less than 30 seconds, that you can review. And I know he's working on some more in-depth ones as well. Okay, so that's kind of a source of information for the Hub itself. Okay, and with this trust, they've got a link to their library website as well. So that's also possible. You can add another link to the Hub as well. Okay, so a lot of this functionality, the features are national. So the look and feel of the service are configured at a national level, and they're designed to stay that way. Other things such as the content you have access to, again, you would, have it configured so what subscriptions you have access to, what database are available would be selectable, searchable, discoverable within this service as well. Okay, so that kind of gives you an overview of the Hub itself. So I'm quickly going to go back to my PowerPoint, and we've had the live demonstration there. I have included some key links to documentation. There is a quick start guide on the new interface that's been around now for a few months since it transitioned back in July. You may want more information on that. We've got the natural language search mode with frequently asked questions. If you want more in-depth information, again, to support your training of users, what they need to know about it. More like this, the recommendations on the Discovery Service and EBSCO hosts. So again, more information on that. Filters as well for the new interface, and also how to create and manage a MyEBSCO account. But as I mentioned, because you're within the NHS in England, typically your account will be synchronized with Open Athens. So once you sign in with Open Athens, your folder will be created and you can save searches, save items beyond the session from then on. We do have a training resources portal for yourselves. So essentially this collates information related to video recordings and webinar recordings on the EBSCO UK YouTube channel. There's a link there to the Help on the Hub page as well. So you go directly from here. We also have training sessions, and we have some more scheduled for November. I mentioned about Synod Medline next week. They will feature the new advanced search results list, which was released last week. So we'll touch on that next week. And we will be scheduling some more advanced sessions in time for December as well. So again, a couple of examples of sessions that are available for registering for. Again, the Help on the Hub. So that is available for yourselves with those tutorials, those short videos that Alan Fricko has created. And of course, we do have EBSCO Connect, the main support portal for EBSCO products and services. So anything you find on here about Discovery will be the generic branded Discovery Service, which you know as the Hub. Okay, but again, there's information on that if you need more background information. And as was mentioned with the question raised about the issues with the format that you use, whether exported to RefWorks, EndNote, etc. If you have any issues like that and others with the Hub, then please direct it towards the NHS service desk to raise a ticket, okay, initially. So once you've done that, those who handle those inquiries would then redirect it to EBSCO if necessary to escalate that. Okay, so they again like to be aware of what's going on, what the issues are, and then can confer with EBSCO when needed. So please go to that page. Okay, and then also within that, you'll find the solutions section, which gives you more information on the various elements of the Hub itself, the content coverage, the use of link resolvers, and so on. So again, it's a good source of information if you want more background to the Hub than we've provided today. And in terms of going forward, I know Janet mentioned the search history being displayed on the result list as a table, as it were. That is coming for the Hub at some point. Not there yet, but it has been released for the EBSCO's databases. So if you want to keep up to date with what's going on with the Hub or with the Discovery Service, then please visit the roadmap at www.ebsco.com/roadmaps. And there's a section on research solutions, and you can filter to the Discovery Service. If you want to receive, and so you can see the roadmap there, okay? So you can filter, and then you can also filter by month as well to see what changes are taking place in the coming months. In addition, we do have the EBSCO Interface Insights newsletter, which is free, so you can subscribe to that monthly. So that will give you a heads up, if you like, of what's changing with the interface. So that will be Discovery, EBSCO Host, and more. Okay, so you can subscribe to that in your own time if you wish to. Okay, I know we're near the hour mark. We did start a little late, but again, you can subscribe to that newsletter. And of course, you can contact me directly at rcrooks@ebsco.com. Okay, thank you very much.